Now we're going to have a look at what your blood tests mean. Before we do this, it's important to note that these blood tests should have been while you were fasting. If for any reason you had not fasted before these tests, please let us know and we'll arrange for another test to be done.
So what do your blood results mean? If your result is less than 6, this is normal and you do not have diabetes at this time, although we may still want to repeat it in the future to check that you do not develop diabetes. If your result is between 6.1 and 6.9, this puts you in the impaired fasting glycemia range, and higher than 7 gives you type 2 diabetes. So now we'll go into a bit more detail about those last two scenarios. If you fell into the range of 6.1 to 6.9, the impaired glucose tolerance range, then you may be asked to come in for more tests. This test is called a glucose tolerance test. The glucose tolerance test is done by you arriving early in the morning on a day where you will receive an appointment. You need to be fasted, as you were for your initial glucose, which means nothing to eat or drink apart from water for 12 hours prior to the test. When you first arrive, we will repeat your fasting blood test and then give you a sugary drink. We then need to wait for 2 hours, so make sure you bring a good book, and we'll repeat the blood test after this 2 hours to see how your body has coped with the sugar load that we gave you. When we have the results, we will contact you, and this may confirm a diagnosis of impaired glucose tolerance, which we will manage by helping you with your lifestyle changes, and may also confirm a diagnosis of type 2 diabetes, which we discussed earlier. Somebody with impaired glucose tolerance has a 50% chance of progressing to type 2 diabetes over the next 10 years. So it's important that if you're in this range, we take it seriously, give you good advice about your lifestyle, and monitor your blood sugars to ensure you don't slip into the diabetic range.
If your blood sugar reading has come back above 7, this may mean you have type 2 diabetes, especially if you are having symptoms such as weight loss, excessive thirst, passing a lot of water, or feeling tired all the time. If you do not have any of these, this may mean that the reading was false or that you are not fasting correctly, so we may ask you to repeat this test.
Type 2 diabetes occurs when the body becomes resistant to the insulin you are producing, making it harder to process the sugar that you are taking in, and also when the pancreas loses the ability to release as much insulin as it has previously. The combination of these two factors lead to the high levels of glucose we see in the blood, and this is what ultimately leads to damage in our bodies, as we spoke about earlier. The most important ways to manage type 2 diabetes are lifestyle, as we spoke about earlier, particularly losing weight. Often we will need to start medications, most people initially on tablets such as metformin, however ultimately some people need to go on to insulin.
Thank you for taking time to watch the video. Hopefully this will help you understand your glucose results more, and there is other information available on the website if you have any further questions.